Your dog stopped sleeping in the bed. Not all at once, just started ending up on the floor. Or they stopped finishing their food. Not refusing it, just leaving some. Or they went quiet, less interested, less there. You probably thought, getting older, bad week, just one of those things. They were telling you something, and they had been for weeks. Your dog has no language, no words, no way to point at where it hurts. What they have is behavior, what they do, what they stop doing, what changes. And research is unambiguous on one thing. Behavioral change is the first symptom, not the second, not the third, the first. Studies tracking clinical onset against owner-reported change found a consistent gap of 3 to 6 weeks. 3 to 6 weeks between the first behavioral signal and the moment an owner booked a vet visit. In that window, the dog was already communicating. The owner just did not have the vocabulary yet. This video is that vocabulary. And it starts with a question most owners never ask. Not, is something wrong? But what has changed? Those two questions have very different answers. Is something wrong asks for a diagnosis. What has changed asks for attention. Dogs can only answer the second one. They have been answering it.
Here is the problem. When a dog's behavior shifts, owners look outward. New schedule, change in weather, something they ate. This is called the attribution error, assigning an internal change to an external cause. And with dogs, it is almost universal, because the alternative is frightening. The second problem is subtler. Owners consistently reframe behavioral change as personality. A dog that gets quieter is called calm. A dog that slows down is called relaxed. A dog that withdraws is called independent. None of those are wrong, but none of them ask why, and the why is the entire point. Because when behavior changes without an obvious reason, there is always a reason. Your dog just cannot make you hear it. Not for lack of trying. The signal is there. The receiver is tuned wrong. That is what this changes. So, what are you actually looking for? Let's go through it specifically.
Let's start with pain. Not the obvious signs. Not limping, not crying. The signs that come before those. Weeks before those. Sleep location change. A dog in pain recalculates the cost of movement. Jumping onto a bed becomes expensive. The floor is not a preference, it is a calculation. Reduced greeting behavior. Your dog used to meet you at the door. Now they stay on the couch, tail wagging, happy to see you, just not getting up. That gap between willing and able is one of the clearest early pain signals there is. Food finish rate. Not refusing food, leaving some. Nausea is a frequent companion to internal pain. A dog leaving the last third of the bowl is worth paying attention to. Withdrawal from initiation. They stop bringing the toy, stop nudging your hand, stop asking for the walk. Pain does not make dogs aggressive first, it makes them quiet first. Research on the canine pain face, orbital tightening, ear position, facial tension, shows owners can learn to read it accurately with less than 30 minutes of training. The face changes before the behavior does. Most owners never learn to look for it. They are looking for the limp, the cry, the obvious thing. Meanwhile, the face has been telling them for weeks.
Pain and anxiety produce overlapping behavioral signals, which is why this matters separately. Chronic stress in dogs leaves a chemical record, cortisol elevated consistently across the day, not because of a single event, because the baseline has shifted. and shifted baselines show up in behavior first. Yawning in non-tired contexts, lip licking with no food present, looking away during direct interaction. These are appeasement signals, a dog communicating discomfort through de-escalation. Owners read them as tiredness or distraction. They are neither. Destruction is the one most owners get backwards. A dog that destroys things while alone is almost never bored. Boredom is calm. Boredom is waiting. Destruction is panic finding an exit. That distinction matters for what you do next. A bored dog needs stimulation. An anxious dog needs a different intervention entirely. Treating panic like boredom makes it worse, every time.
Now the one most owners get wrong most often. Roughly a third of dogs over age 8 develop canine cognitive dysfunction. The behavioral signals are specific and early. Waking in the night for no apparent reason. Standing in a room as if they forgot why. Reduced or altered greeting when you come home. Getting stuck. Getting lost in familiar spaces. Sleep location change. Again. Here is what makes this urgent. There is an intervention window. Dietary, environmental, and medical options exist that slow cognitive decline measurably. But that window is only early. Most owners miss it. Not because they don't care, because they called it getting old. Getting old is not a diagnosis. It is a reason to look harder, not less. Because the window does not stay open. And once it closes, the conversation you could have had with a vet 6 months earlier becomes a much harder one. That is not meant to scare you. It is meant to move you. Because in every one of these categories, pain, anxiety, cognitive decline, the dog that gets help early lives better than the dog whose owner waited. That is not an opinion. That is what the research shows.
If this is useful, subscribe. Hit the bell so you don't miss the next one. And if you know someone with an older dog, send them this. Now, the system. Here is the practical part. You do not need to be a veterinarian. You need a baseline. A baseline is just what is normal for your dog, not dogs in general, your dog. Because the signals are only visible against a background of normal. Without that background, nothing looks unusual. With it, a 2-week shift is obvious. 4 things, once a week, 2 minutes. 1. Where did they sleep last night? Bed, floor, crate, couch. Note it. 2. Did they finish their food? All, most, half. Just note it. 3. Did they initiate contact today? Brought a toy, asked for a walk, nudged your hand. Yes or no? Note it. 4. Greeting behavior when you came home. Met you at the door, stayed on the couch, got up slowly, did not get up. Note it. You are not diagnosing anything. You are building a record of normal, so that when something changes, you have something to compare it to. And you catch the 3 to 6 week window instead of missing it entirely. 4 data points, 2 minutes. That is the difference between 3 weeks and 3 months. Now, the one signal that matters most.
One signal above all others. A dog that stops seeking your company. Not a dog that is resting more. Not a dog that is calmer with age. A dog that once wanted to be near you and quietly stopped. Veterinary behaviorists rank this signal highest across pain, anxiety, and cognitive decline. It appears in all 3. It is the most consistent early marker there is, and it is the one owners most often call just getting older. It is not. It is a sentence. Learn to read it before it ends. So, your dog stopped sleeping in the bed, stopped finishing their food, went quiet, Those are not personality traits. They are sentences. What's the one change in your dog you almost wrote off as nothing? Tell me below.